University. Today, I will be performing to you the following laboratory activities. Part 1 will be the proper hand washing technique and part 2 will be the PPE donning and Duffin return demonstration. Without further ado, let's get started! Hand washing is essential component of laboratory safety and should be the first and the last step of all procedure working in laboratory area. Hands must be washed before and after each laboratory activities and when dealing with patients. Proper hand washing does not sterilize the hands but removes surface contamination, infections, microorganisms, and dead skin. Hence, the healthcare worker and patients are protected. Always remember that hand washing prevents cross-contamination between patients and workers, specimen and workers, and specimens and patients. Before doing the hand washing, let's know the equipments are or materials needed. We have sink for hand washing, clean paper liner, clean hand towel, clean pieces of paper, clean paper towel, antibacterial liquid hand soap, and lastly, temporary waste receptacles. For the conduct, the following steps are present. Step 1, stand in front of your sink. Step 2, beside at your sink, get a rag and wipe it up. After, get your clean paper liner and place it at the side of your sink. In your clean paper liner, all clean materials will be placed inside except for the temporary waste receptacles. We have clean pieces of paper or clean paper towel. This will be used for turning on or turning off the faucet if the sink is not operated by foot. Always remember that do not touch the handle of the faucet because it is not disinfected. We also have antibacterial liquid soap, and followed by clean hand towel. Place it inside the clean paper liner. And lastly, we have temporary waste receptacles. Place it outside or a little bit away from the clean paper liner. So that is here. So that's the material for the hand washing. Step 3, get your clean hand towel and place it at your shoulder. This will be used and the convenience way to dry your hand after washing. If you are left-handed, place it the right of your shoulder. If you are right-handed, place it at the left of your shoulder. And step 4, remove all the jewelries or check for nail cuts. Step 5, turn on the water the faucet on using a clean pieces of paper or clean paper towel. Do not turn off the water for the entire procedure, just let it flow. After turning on the faucet, dispose the clean pieces of paper in the temporary waste receptacles. Step 6, assist your hands in front of the sink. Step 7 will be the hand hygiene technique with soap and water duration the entire procedure. First is wet your hands with water, keeping fingertips lower than your wrist. And then apply enough soap all hand surfaces. Rub hand palm to palm. And followed by right palm over left dorsal with interlaced fingers and vice versa. the palm to palm with fingers interlace. And followed by back with fingers to opposite palms with fingers interlock. And rotational rubbing of left thumb claps with the right palm and vice versa. Rotational wrapping backward and forward with clasped fingers of right hand in left palm and vice versa. Rub your wrist and the other wrist. And remove excess soap. Rinse hands with water and keeping fingertips below the elbow. And then dry your hands using a clean hand towel, which is put at your shoulder. Pick it up and pull it up. And just tap your hands and the other hands. And then return it to the clean paper liner. For turning on off the faucet, get clean pieces of paper. Cover the handle of the faucet. Do not touch the faucet without cover since your hands are now clean. And then close it up. And the clean piece and the clean pieces paper, dispose it in the temporary waste receptacles. And your hands are now clean. That's the procedure for the proper hand washing technique. In separated video, I will be performing to you the proper PPE donning and doffing return demonstration. See you there and thank you for watching.